Hello, I'm CHURN from the Harbours medical practice, and this is a short video about asthma and things that you can try to improve your asthma control. Well, I'm here in front of the RNLI lifeboat station in North Berwick, and I want to illustrate a really big difference between the two types of inhalers that you're likely to have, the preventative inhaler and the reliever inhaler. I want you to try and think of it as like safety and rescue. Your preventative inhaler is your safety inhaler. By using it regularly, you're going to stay safe. Try and stop yourself from having asthma symptoms and reduce the frequency and the severity of any exacerbations that you may get. Your reliever inhaler is like your rescue inhaler. So that's the one to use when you get into difficulty in the water. Using your preventative inhaler is probably the best way of keeping yourself safe. Well, we've come out to a very windy Port Seaton harbour to demonstrate a big difference between your inhaler device and how that affects your inhaler technique. So, your inhaler is either going to look like this. This is a pressurised MDI. It's got a propellant together with a drug. So you press down on the cartridge and it shoots out the medication into your lungs. These are breath activated DPIs. They've got a bigger particle, no propellant, and we're going to need to generate that Port Seaton wind ourselves. I'll talk you through it. So, pressurised MDI, you're going to need to mix the medication with the propellant. You then breathe out, and then you don't need that forceful of breath in. Slow, long breath. Press the cartridge at the start of the breath, and then hold your breath for a good 10 seconds afterwards. It's going to look a bit like this. And so on. If your dose has 2 puffs in it, for the second dose you wait 30 seconds to a minute and then you repeat it. It'll look a bit like this again. And then hold your breath. These ones, remember, there's no propellant, there's no Port Seaton wind, so we're going to need to really generate quite a lot of airflow ourselves. So, you check that you've still got some doses in it, you open it up, breathe out, and generate your Port Seaton wind. Asthma.uk has got a fantastic website where they talk you through the technique for each of the different inhaler types. There's a lot of them around and it can take a bit of getting used to your inhalers. Well, for some of us, as the weather warms up and these beautiful flowers appear, our eyes begin to water and itch. We start to sneeze uncontrollably and our noses completely block up. So this is a reminder that asthma is linked with hay fever and eczema. They're all allergic conditions, so it's important to treat our hay fever symptoms, which can also improve our asthma control. So, by trying an antihistamine tablet and see if that helps, and really being aware of how pollen behaves through a day. So if the day warms up, these clouds of pollen lift up higher into the atmosphere. So just opening your windows later in the day when it's warmer can really stop these pollen triggers from entering the house. And it's a reminder that breathing through our nose is actually the most efficient way to breathe. It not only warms and filters the air, but it also activates our diaphragm and leads to a greater oxygen delivery into our lungs. So treating the symptoms of a stuffy nose with a hay fever tablet or a nasal steroid spray can make a big difference to our asthma control. So this is a reminder to think about triggers also inside the home, such as mould or damp in your bathroom. Getting to know your asthma symptoms, shortness of breath, wheeze, cough and chest tightness, together with understanding your peak flow, can help you really understand what might be making your asthma symptoms worse. Well, next we're going to talk about exercise, which can make a huge difference to your asthma control. Not only by increasing your lung fitness, but also by reducing the amount of coughs and colds that you get by increasing your immunity. I think more than that, when you're breathless and wheezy as an asthmatic, it can feel really frightening. And actually, by learning that breathlessness can be a good thing through exercise, gives you a bit more control and a lot less anxiety about that horrible feeling. We want you to be safe about it. So, using your reliever, blue or rescue inhaler before you go and taking it with you at all times can can really reduce that anxiety. Why don't you try exercising with a friend? Going together for a run or a cycle or a swim can really make it feel a lot safer. Try and do it in an environment where there's lots of other people around. So if you do get into trouble, there'll be somebody there to help you. Try it. I really think it'll make a huge difference to your feeling of breathlessness and your asthma control. Well, we've nipped behind the bike sheds to talk about smoking, and you'll be relieved to hear that I'm not going to give you a lecture about why you shouldn't smoke, so I figure you guys know that already. But what I would encourage you to think about is exactly why it is that you smoke, what you get out of it. Do you enjoy it, or do you do it to help you relax? Maybe it's just a big part of your identity and how you think other people see you. Understanding why you smoke can really help you cut down. And I want you to feel really good about every single cigarette that you don't smoke. So if you are still smoking but cutting down and you go from 20 cigarettes a day to 19 to 18, well, good on you for every single one that you don't smoke. And if you do manage to stop completely, well, good on you. You should feel incredible. And then you get to tell everyone else exactly how you did it. Well, thank you so much for watching. Hopefully there are some tips there that might improve your asthma control. And we really want you to be in charge of your asthma management, to know what symptoms might suggest that your asthma could be better controlled. Shortness of breath, wheeze, chest tightness and cough. And get in touch, make an appointment with the practice nurse for an asthma review and see whether changes to your inhalers might improve your symptoms. Your asthma shouldn't be restricting what you do. It shouldn't be waking you at night, and it shouldn't be stopping you exercising. So let us know. Thank you so much for watching. Stay safe.